Good afternoon all, and thank you for joining us on today's webinar on radiation compliance. We're looking at this topic today of radiation compliance in dental practice. The reason I've chose this topic to go through is because we've been doing quite a bit of inspection trend analysis in the background, and we've seen that consistently from the start of this year there's been a bit of a problem with radiation compliance following CQC and HIW inspections. So we're going to go through various topics during this webinar to look at what the inspectors are looking for during their inspection and where it is that practices have been falling down on demonstrating compliance with radiation safety and what evidence they're asking for and what evidence practices are failing to provide. So as you can see on the screen at the moment, those are the topics we're going to go through. We're going to look at them all in detail, and I'll advise on exactly what it is the inspectors want to see from you when they come knocking on your door. So as mentioned, behind the scenes here at Agilio, we go through 10 reports from both England and Wales every month, looking at what CQC and HIW are picking up when they attend your practices to do a healthcare inspection. So from a radiation point of view, to date, we have looked at 95 inspection reports across England and Wales between January and July 2025. So from a radiation perspective, we can see that only 46% of practices inspected to date have been fully compliant with radiation requirements. So that's less than half. That's only 49 practices out of 95 that have been inspected. So it is a bit of a concerning area, to be honest. And I'm hoping that when you leave this webinar, you'll be provided with the information you need, that if CQC or HIW come knocking on your door, that you'll have the evidence ready for them. So looking at the evidence in particular, there are 6 things I'm going to cover off in detail during this webinar. The first of which X-ray equipment records. So 40% of practices have failed to provide sufficient evidence around X-ray equipment maintenance. So that's your critical examinations, your routine assessments, your acceptance testing. So again, we'll look at that in detail in a few slides' time. But that's your highest percentage of downfall here. That's where the majority of practices are failing, is to provide that evidence to the inspectors. Secondly, we have the radiation protection file. So again, inspectors are looking for a comprehensive file on site that contains the policies, procedures, and templates, and that they will check that all of these are up to date, that they've been recorded sufficiently, and they're being maintained as well by the practice. So we'll have a look at that in a bit more detail. Then we have your local rules, so your working instructions, what you need to have on these, where they need to be displayed, and what the expectations are. So again, only 11% of practices have failed to demonstrate compliance with local rules. Radiation training. So again, 11% of practices have failed to demonstrate compliance with this. So this is your update training, and being able to provide sufficient evidence that your operators are trained as well to undertake exposures in the practice. Then we got your RPA and MPE, so radiation protection advisor and medical physics expert. So again, 77% of practices have failed to present sufficient evidence to say that they've got these experts in place. And then we've got 6% of practices have failed to demonstrate that they've got the appropriate health and safety executive registration in place. So those are your figures there. We can see where the downfall areas are during inspections, and we'll go through each of those in detail during the course of this webinar to explain a little bit more what the inspectors want to see from you. So we'll start at the beginning really, and we'll look at the HSE registration. So if you're undertaking radiation in a practice, you must legally register with the health and safety executive. So there's 3 ways to inform them. There's a notification, a registration, and consent. For a dental practice, what we need to worry about is registration. And over the course of the last couple of months, there has been confusion about this. The Health and Safety Executive last year did do an update in relation to consent, but that doesn't apply to us. So it caused a little bit of confusion. People were jumping on board and going, oh, do I need to update or do anything in relation to this? But notification and consent doesn't apply to us. Notification is regarding if you're working in an area that's got significantly high levels of radon, and consent is where you're working with industrial level radiation. But as you can see here, registration is required where we work with X-ray generators, so your X-ray machines. And that can be any X-ray machines, your portable handheld X-ray machines, your intraorals, your panoramics, or your CT scanners. So if you're using any one of those pieces of equipment on site, you must legally register with the Health and Safety Executive before carrying out work with ionizing radiation. So it is a one-off registration, and you do it using the online service provided by HSE. It's called Radan. That replaced the historic service a couple of years ago, but it's all done online. It's quite an easy system to use. So if this is something you've not already done, or if you're not using X-ray equipment at the moment, but you're looking at introducing it, then make sure that this is something that you prioritize and do first and foremost. You register as the employer undertaking the work, not as the practice. So essentially, your company's house registration. Whoever you are as the employer, if you're a group, then it's the employer, the group name. It's not the location that you're undertaking the X-rays. The individual locations, if you are a group, do not need to be registered individually. So it's a one-off registration for the employer. It costs around £26, and once you've done it once, that's it, it's done. It doesn't expire, it lasts indefinitely. As part of the registration, you provide the locations that you undertake the ionizing radiation. So if you have got multiple locations, you will list them. And you also provide the number of X-ray equipment, or approximate number of X-ray equipment you use at each location. So it's a little bit differently. Historically, 2 to 5 years ago, you had to register each location individually. You no longer need to do that. One registration for the group. When you've registered, you will be provided with a certificate from HSE, so you need to make sure that you keep that on file. You then need to make sure that that registration is kept up to date. So any material changes to your registration, such as change of address, change of business name, you must legally notify the HSE so they can update the registration certificate. Again, any changes to your registration you can do using the HSE's ionizing radiation contact form. So again, it's all done online. This form can also be used to identify if you've got a current registration. So if you're currently now listening to me thinking, oh, I'm not sure if I've got this in place, then you can go onto the HSE website, type in ionizing radiation contact form, and you can use that service provided to check whether or not you've got a registration with them. If you've misplaced your certificate, again, you can request a copy of your certificate. So the first thing you should do from leaving this webinar is check that you've got this in place. Check your files, check your certificates, make sure you've got the HSE registration certificate. And if you haven't, go onto the HSE website, see if you've got a registration, and request a copy of the certificate if you have. If you haven't got a current registration, then you need to ensure that you do that straight away. So from an inspector's point of view, this is something that they look at, and they do want to see evidence that you've got the certificate on file. So a couple of comments here to show you the sort of feedback that the inspectors have made this year. You can see the top one is that they've seen that the practice has got a certificate in place. However, the certificate was out of date. So it must have contained the wrong information. It could have been the business name. It could have been the address, but it wasn't kept up to date. So they've flagged that. They will look at it. And then the second example then is that the provider didn't have a certificate at all. So again, in breach of their obligations to do this. So again, I'm hoping that most of you, if not all of you, have got this in place, but please, if you haven't, or if you've got any uncertainty, check this straight away. So the next thing then you need to look at doing is appoint a RPA or MPE. These are two separate roles. and they have different responsibilities. So the responsibilities for an RBA include supporting practices with the undertaking of a radiation risk assessment. Also, the designation of your controlled and supervised areas, so the rooms and areas in which you take radiation exposures, and the drafting of contingency plans. So these are only examples of the responsibilities. I've picked out the key ones, but they've got a lot of additional responsibilities as well, which are all listed under the ionizing radiation regulations. The medical physics expert then has separate responsibilities. So they will assist practices with acceptance testing of equipment, so making sure the equipment is fit for purpose and ready to be used for clinical exposures. They will check for and support practices on installations. So they will check that the specifications and the requirements to install new equipment is appropriate. And they will also advise and support on the appropriate training of your practitioners and operators as well. So again, these are the key things. There are more, and these things are governed by the ionizing radiations and medical exposures regulations 2017. So they both have different remits. They both fall under different regulations. And they both will support each other as well in relation to providing general advice in handling of radiation incidents and investigations and dose assessment and quality. Now, what we are familiar with in the industry of dentistry is these two roles being combined. So they generally will be undertaken by one RPA body, a corporate body that has been approved by the Health and Safety Executive. Okay? So they are separate, but we associate them as the same thing. And we, as well as our inspectors, will generally just refer to them as an RPA. What they mention by that is an RPA body, a body that incorporates both the RPA and MPE roles under one umbrella. So they are separate, but they work in collaboration with each other. They can be part-time or full-time employees or consultants. The general is that they are passed over to external consultants. Whoever undertakes these roles must be an expert in the field, and they must demonstrate compliance with the HSE's core competence levels in training. And as I've explained, they are usually combined and provided by one umbrella RPA body. So there are lots of RPA bodies out there. You've got Stephen Green, you've got Dent RPA, you've got HPA, you've got lots. So in the majority of cases, practices will have a contract in place with an RPA body to provide these services. The appointment, however it's done, must be provided in writing. So that's either through a service level agreement, a contract, any sort of thing, but it must demonstrate what provision they're providing, what services they're providing, and obviously how long that contract is in place for. So again, this is what inspectors want to see when they come knocking on your door and they undertake their healthcare checks. So they want to see that you can demonstrate written evidence that you've got this service in place. So again, a couple of quotes from this year from the inspector's point of view is that there's no documentation. The second quote there at the bottom, you can see that the practice didn't have any formal agreement in place with an RPA body. And the top one is that they did have an agreement in place, but they weren't utilizing them as they should be. So they're not speaking to the RPAs in relation to installations and X-ray equipment. So it's not just a case of having these in place and having that written agreement to show inspectors. It's ensuring that you can demonstrate to inspectors that you are using them and fulfilling that contract as well by engaging them appropriately to support you within their roles and remits. So again, check that you've got this on file. Check that if you have got an RPA contract in place, that it's in date, because again, they do expire. So you want to make sure that they haven't expired without you being aware of that. And if you haven't got something in place, phone around, tender the services, see what provider you're happy with, because like I said, there are lots out there that can provide this service. I've mentioned 3 of them. Those are your big ones: Dent RPA, Stephen Green, and HPA, Health Protection Agency. But there are others. So have a look around, see which ones suit you best, and get that contract in place. So once you've got that in place, then your RPA will generally, in most cases, provide you with a radiation protection file. The majority these day and age will provide you with a hard copy file and an online version of it as well. I know Dent RPA, I know Stephen Green and HPA do that, so they will give you a physical folder and access to their online services will give you all the templates you need to populate an RPA file. So your RPA file will consist of your policies, your procedures, and various other templates as well to help you demonstrate that you're managing the regulations around ionizing radiation sufficiently. So a couple of templates the inspectors will look at when they come in and what they expect your RPF file to contain is an X-ray inventory. So this is a template that will detail all the X-ray equipment that you use on site. It will include details of the location of that X-ray, so your surgery rooms, whether that's by surgery number or surgery name, the make, model, and the serial number of each piece of X-ray equipment, when it was installed, so that's your critical examination date, and if the equipment has been disposed as well, and the date of that, if applicable. So this is one of the key documents the inspectors will look for as part of your radiation protection file. So again, have a look at the templates provided by your RPA, see if they've got this template in place, and populate it if you have. If you haven't got this template or provided by your RPA, speak to them about it. Ask them, see if they can support you with it. And they should be able to in the majority of cases. This is generally something that they'll provide. So make sure you've got this in place and make sure it's up to date, because again, the inspectors will cross-reference what you've got on this inventory with your actual equipment on site. So they will cross-reference the serial numbers to make sure they match up. They'll cross-reference the surgery rooms and locations. The next document then they will check for is a radiation risk assessment. So again, as I mentioned on the previous file, your RPA, one of their primary responsibilities is help you populate a radiation risk assessment. So a lot of radiation protection advisors will provide you with a template with this as part of their services. But you don't have to do an individual template. You can incorporate a radiation risk assessment into your general health and safety risk assessment as well. So you can do either, do an individual one or incorporate it into your general. Either is absolutely fine, but you've got to be able to demonstrate that you've incorporated a risk assessment in some way or another to satisfy your CQC and HIW inspectors. As I mentioned, speak to your RPA if you're not sure how to complete it, because that is one of their primary roles, and they will help and support you with it. And then obviously you must keep the assessment up to date. So if you introduce new equipment, especially more high-risk equipment, if you bring in place a CT scanner when you've never had one before, that has a higher level of ionizing radiation risk than the intraoral or panoramic. So you need to incorporate those higher level of risks into your risk assessment and make sure that it's always maintained. The risk assessment process is about ensuring that you've put the appropriate controls in place to minimize the risk of unnecessary exposure to people as far as possible. So this considers the three main principles of radiation safety. Shielding. Have you got the appropriate shielding in place to make sure that people are not getting unnecessarily exposed? So that could be lead lining. That could be ensuring that operators are standing outside the surgery. That ties into distance. So again, making sure that no one's standing within that immediate 1.5 exposure radius. The further back you go, the more safe you are from unnecessary exposure. And then the time as well is the third element. So make sure that no one's being exposed to unnecessary levels and timings of radiation. So again, an intraoral will be a quick switch of the button to turn it on. That's only 10 to 30 seconds exposure. But if someone is keeping hold of that trigger and exposing people unnecessarily, then obviously the time factor is not being considered. So those are the three things that you need to look at when you do your radiation risk assessment. But again, the RPA is there to support you with that. The third element then is your operator list. So again, inspectors will look for an up-to-date list of all operators on site. So an operator is any staff member who's involved in any practical aspect of taking exposure. So this could be patient identification, positioning the patient or the X-ray tube head, pressing the exposure button, setting the exposure parameters, and processing images. So if you're involved in any of those elements, then you are essentially an operator. And you need to have sufficient training to be able to do those particular tasks. So inspectors will look for this. They want that operator list to include names of the operators, their position within the practice, whether they're a dentist, a nurse, or anyone else, the qualifications and the ongoing training that they've got. So again, speak to your radiation protection advisors if you haven't got a template for this already as part of your file, and make sure you get this populated and keep it up to date. And then lastly, the inspectors will look for a sufficient quality assurance program. So this is mandated by the ionizing radiation regulations. And there are various elements to it. Not all elements are going to be applicable to every practice. It depends on what sort of equipment you have on site. But the top one, if you are taking exposures, all practices are expected to do. So you're expected to do a 6-monthly image quality audit, where you take a selective analysis of radiographs and then track whether or not they were acceptable or unacceptable and mark that down as part of your audit. So inspectors, that's one of the key quality assurance audits that inspectors look for. And then they will also check that you're doing what's called a reject analysis. And this is an analysis of any unacceptable images. What was the reason for those unacceptable images? Is it down to patient positioning? Is it down to lack of training? Is it down to faulty equipment? What was the reason for it? And what remedial works or recommendations have you put in place to avoid that happening again? So they want to see that as proactive management. Then you've got your film processing quality assurance. This is more around if you're doing manual developing. So if you have got a manual developer on site, they want to see that you've got a log in place for changing the fix and developer solution, and that you're undertaking step wedge testing as well to monitor the performance of that developer. So again, there should be a template, or there should be an online functionality as part of your RPA file to be able to do those quality assurance checks. And then likewise, if you're doing digital radiography, there should be a set of templates for you to undertake for digital detectors and phosphor plates. So a visual examination to make sure they're not deteriorating, that they haven't been damaged or missing or anything like that. So check what templates you've got in place as part of your radiation protection file and ensure that you're putting these in place at practice level and that you're keeping on top of them to be able to demonstrate to inspectors that you've got an effective QA program at practice level. So those are the 4 key things that inspectors will look at as part of your radiation protection file. So again, from an inspector's point of view, let's take a look at what they're saying. So the top one, this practice in particular didn't have a radiation protection file in place at all. So they had nothing. They didn't have any of these templates that I've just discussed to demonstrate that they're keeping on top of the requirements of the radiation regulations. And underneath then, this is an example that they did have a file, but they were missing some of those key documents. So in this case, they were missing the X-ray equipment inventory and the radiation risk assessment. So again, these are not just tick box exercises. These are things that they will proactively look for. So please make sure you go away, you check your radiation file, check that it's up to date and all information is accurate and represents the processes at practice level. And then you'll be able to effectively demonstrate to inspectors when they ask or look for this, that you're doing everything that's required of you. So another set of documentations they will look for, which again are incorporated as part of the radiation protection file, are your local rules. So again, this is a very key piece of evidence that inspectors will come on site and check that you've got in place. And these are essentially a written set of working instructions to restrict exposure to ionizing radiation as far as possible. So any operator working in an environment that takes exposures should be able to refer to these to understand what they need to do to minimize the risk of exposure. As a minimum, they must include the name of the radiation protection supervisor. And I have got a slide to go through this, the role of the radiation protection supervisor later on in this webinar. They must also describe the designated controlled and all supervised areas. So this is in the environment in which the exposures are undertaken. And they must include then a summary of the contingencies contingency plans for people to follow in the event that there's a radiation incident. So, for example, if an X-ray intraoral X-ray unit was cracked and you weren't able to turn it off, and it was generally consistently generating exposure levels, then what do you need to do in that sort of situation? So they must list all that information as a minimum. Inspectors do like to see additional information on it. They like to see that the RPA is listed on them. They like to see that there's a list of operators listed on them as well. But as a minimum, those are the requirements. In addition, you are legally obliged to ensure that all those people involved in working with radiation at practice level are informed of these local rules. So this is quite an open-ended legal obligation. This doesn't mean that you have to legally display them in your clinical environment. However, by displaying them adjacent to your X-ray equipment is best practice. If you've got them on the walls in your environments next to the X-ray equipment, then they're there for people to refer to when any person coming into that environment to take exposure. This is seen as best practice, and this is what the inspectors like to see. But as I said, you're not legally obliged to do it. If you've got another mechanism in place to ensure that your operators are being shown these local rules, that could be part of the induction, that could be part of ongoing training, staff meetings, anything like that. And you're confident enough that your staff members know about these local rules. So if inspector asks them and questions them about them, they'll say, "Oh yes, I'm aware of those. They're in the folder that's in the drawer in that particular location, or they're held here. I'm told about those local rules, and we have regular meetings on them." Then that's no problem at all. But what you don't want is an inspector to ask one of your dentist or nurse about local rules and then go, "Oh, I'm not sure. What are those? I don't know where they are." That's what you need to avoid. So by having them displayed is the best, because that eliminates the uncertainty then or reliance on staff members to remember where they are. But you have got choice. You have got choice in what you do with them. So again, inspectors, the local rules, they will check them. They will check the information is up to date and that they're relevant to each working environment. So the top one, as you can see, it was not specific to that particular environment. It was probably a generic local rule that hadn't been adapted. So make sure that the working instructions reflect each surgery that the local rules are intended for. And then the bottom example there is that they were out of date. They referenced the old 1999 regulations instead of the new 2017 ones. So again, make sure that your templates are kept up to date. So then they will look at your equipment records. So as we saw at the start of this webinar, this is the biggest area of downfall for practices. 40% of practices are failing to demonstrate that they've got sufficient evidence of this in place. So all X-ray equipment, no matter what type of equipment you're using, must be examined and accepted into use before it is used. And then it needs to be assessed at routine intervals thereafter to make sure it maintains it's maintained in good working order and fit for purpose. So before we look at these three in detail, there's one thing to discuss first, and that's before you use any X-ray equipment, before you install any new X-ray equipment, you must consult your RPA regarding the plans for the installation. Now, I used to carry out on-site health and safety risk assessments, and I used to support practices personally with installations of X-ray equipment. And I generally saw a lot of examples where this step was omitted or not thought about beforehand. And what some practices do is they go straight into the critical examination. So they contract their installer. Their installers come in, fit the piece of X-ray equipment, and then carry out a critical examination. So this is a document that ensures the installation was done effectively. It checks that all the safety features are working, and it verifies that there's sufficient protection in place to prevent exposure to ionizing radiation. Now, the problem with getting this done first, before the step before, is that if you haven't put in place the appropriate protection, your lead lining or anything like that, it's a lot harder to do retrospectively after the equipment has been installed than putting it in place before the equipment has been installed. So if you consult your RPA before any installations, They will check the plans, and those plans that are provided by them should indicate the location of the room, whether it's on ground floor, first floor, second floor. It should indicate the occupancy of any adjoining rooms. It should indicate the construction of the walls to the room that the equipment's due to be installed in. So whether they're solid, lead-lined, partition, whether there's any windows in that wall that could point out into a high pedestrian area. It will indicate all those those factors. And the RPA will then review that and analyze it and come back to the installer going, right, before you install this equipment, make sure that wall has got lead lining, make sure the door is sufficiently protected. They will dictate. The installer then can put all that in place before installing that machine. If you do it the other way around, as I've already said, it's a lot more difficult to then install all these protective measures once you've already got your intraoral or panoramic equipment all fitted and ready to run. So please make sure going forward, if you're installing new equipment, you consult your RPA first before getting the critical exam undertaken. Once the exam is undertaken, it then needs to be accepted into use. So this is essentially an RPA confirming that you can now use that equipment for clinical exposures. If they haven't accepted into use the X-ray equipment, you are essentially illegally using it. So make sure you've got documented evidence of a critical examination and it's been accepted into use. Generally, the critical exam and acceptance test will go hand in hand. So your RPA will sign off both in one sitting. But speak to your RPA. All the RPAs, sometimes what happens in these situations is the installer will arrange this. They will have their own contracted RPA in service, and they will bring them in to do these as part of the install. So make sure you have those chats with the installer, establish who is responsible for getting that RPA. If the installer hasn't got any RPA to do it, then you need to bring yours in play to make sure that they undertake these. So it could either be done by the installer's RPA or your own, but one RPA needs to do it. Then once the equipment is installed and you're using it, you then need to make sure that it remains fit for purpose. So this is what's called a routine assessment, or as per the regulations, a periodic examination. So this is generally your 3-yearly examination. So this isn't a service. This is very different to a service. A service is something that is done annually, and that's just a physical check of the equipment to make sure that it's not damaged. A routine assessment is an extension of the critical examination. Your RPA will come in and examine that all those safety features that were put in place upon install are still working, still in good working order, and that the equipment is still clinically fit for purpose. So 3-yearly is the general rule. That is what everyone is accustomed to. It can vary, and it will generally be dictated by the RPA. So if an X-ray piece of equipment is coming towards the end of its life, an RPA may advise that you need more frequent examinations done. But generally, 3 years is what we're accustomed to. So again, from an inspector's point of view, make sure you've got documented evidence of all these steps on file, even the very first step as well. Make sure you've got evidence that you've consulted your RPA before any installations and that you've got that in written format, whether that's a formal report or an email confirming that the install is good to go ahead. The inspectors will look for that evidence as part of their inspections, and that's why we're seeing that 40% failure mark come up, because in one way or another, practices are not demonstrating that they've got this in place. So the top one there, a critical examination report was obtained, and this is a good example of what I was saying. It was done before the practice consulted the RPA. So it had highlighted recommendations that had not been acted on, and then the practice had to then retrospectively consult the RPA to try and put all those measures in place. If it was done the other way around, they wouldn't have had this issue. And then the second example is that they couldn't even provide the evidence of critical exams being undone. And this is something common that we see. Obviously, a piece of equipment could have been installed 10 years ago. So a lot of documents do get misplaced. So you just need to try your hardest to try and find those original critical examination documents. And if they have been misplaced, try and get hold of the company that installed them and see if they got retrospective copies of the install documents that they can provide you. So have a quick look through and try and find them. If you can't get hold of your original critical examination documents, and you can't track them down through the install or anything like that, then just demonstrate that you've done all that is reasonable of you, that can be reasonably expected of you, to try and track them down. And then make sure that you've got your routine assessment reports on file to demonstrate that the equipment has been routinely checked since that install date and has been consistently signed off by an RPA as fit for purpose. So the next thing then is radiation training. So inspectors will want to see evidence that all your operators are up to date with their training, that they've all got their certified training in place originally. So a dentist, they will check that they've got their relevant training certificates on file, and the same as a dental nurse involved in radiography procedures, certificate in dental radiography. And then that those certificates and training are being kept up to date. So there are governed under the IRMA regulations a set of training requirements. So every person involved in radiography, an operator, has to demonstrate that the training they've received covers what you can see here. So the training certificate and the content within that must be able to demonstrate that all of those that you can see are covered off. So properties of radiation, radiation protection, radiation hazards and dosimetry, special attention areas, justification, practical aspects, and any specialist techniques that you use in practice. So your original training must demonstrate that you've had all that covered off. So the second point on the left you can see there in white is that as part of training being provided, people can undertake certain practical aspects of it. But that doesn't allow that person then to go away and undertake the full comprehensive remit of an operator without all that training being certified. So as part of the practical elements, they may have hands-on experience of dealing with processing or positioning the X-ray tube, but that doesn't sign them off to be able to do that until they've got that certified document in place. And then going back to the operator list that I explained as part of the radiation protection file, you need to keep an up-to-date record of all training received by your operators. So inspectors will look for this. They want to see that this is in place. And as well as this, they will also want to see that operators are keeping up to date with the GDC highly recommended topic. So anyone that is registered with the GDC needs to maintain 5 hours of training every cycle. So this is a highly recommended topic, but it is something that inspectors are looking for. So if you haven't got a CPD provider for this at the moment and you're looking to be able to put this in place, then we as a company have got CPD through our iLearn product. So this is something that we encourage practices to do, even though it is only highly recommended by the GDC. We know through inspection trends that inspectors, both CQC and HIW, are looking for it. So a little pop-up will come up on your screens now, and if you haven't got a CPD provider in place, feel free to click it. We can ask any questions that you've got around it, and obviously iLearn has hundreds of other courses as well on the platform to provide you with all the CPD training requirements you need. So feel free to click, have a look, inquire, see how else it can support you. But from a radiation point of view, make sure you've got documented evidence of this training in place. So again, inspectors will look at this. They want to see that everyone's up to date with their training as per the second quote that you can see below. And they will also look as well as that original training from practitioners and operators as well. So in this case, their training that they had provided did not cover the specialized techniques that this practice was using. So it didn't cover anything around CPD training. So ensure that your training encompasses all those requirements and all the processes that you are undertaking in practice. So finally then, we're going to look at the RPS. So an RPS, Radiation Protection Supervisor, is a different role to the RPA. The RPA is generally an external consultant, an expert that's contracted through a service agreement. An RPA is someone appointed at practice level to then oversee the implementation of the radiation regulations. So fundamentally, their role is to oversee everything that I've explained in this webinar. It's usually a team member, and it's someone with the capacity to undertake the role. But the key thing to understand here then is an RPS doesn't have the full legal responsibility of ensuring compliance with radiation. That sits with the employer. So I know in the historic cases, RPSs have been a bit reluctant to take on this role because they feel there's a lot of pressure on their shoulders to get it right. But that fundamental responsibility always lies with the employer. The RPS essentially is someone, just like your first aiders, your fire marshals, your safeguarding leads, your infection control leads, there's someone to help. There's someone to help to oversee the day-to-day implementation of radiation compliance. They should be someone familiar with the requirements of the regulations and the local rules relevant to the work. So they should have some familiarity with the processes undertaken. They could be anyone. They could be a receptionist. But ideally, it should be someone involved in the day-to-day exposures of patients and processes in the practice. So really a dental nurse, a clinician, practice manager, someone like that would be ideal. If you wanted to appoint someone else, such as a receptionist or a TCO, then ensure that they've been given the relevant training to enable them to fulfill themselves, that they're confident with the position of this. And when you appoint an RPS, you should also make that appointment formal in writing. So that could be a separate appointment contract, or it could be as part of their employment contract. So again, your RPAs will generally provide you with a template or a letter that you can adopt to give them. But this formalizes the role, formalizes the position. And it also then formalizes their responsibilities, so they know what is required of them to undertake this role. So those responsibilities include everything that I've discussed in this webinar. They need to ensure that you've got your HSE registration in place and that registration, it remains up to date. They need to liaise with the appointed RPA and MPE for installations, for any investigations, for general queries, advice. So they're your link between the practice and the RPA. They need to maintain the radiation protection file, make sure it's up to date, make sure everything is accurate, oversee the quality assurance program. They need to ensure that local rules are being followed, and then to raise any concerns if someone is not adhering to them. So the RPS is not really responsible or expected to have those difficult conversations with someone who's not adhering to the rules. There to oversee it and then to escalate that then to whoever the appropriate person is, whether that's the practice manager or the principal dentist, or if you're a group, someone more senior in the organization. They need to ensure that the equipment is being maintained and that the records are on file. Also then coordinating with the service engineers, with the RPA, to make sure that the renewal dates are being met and that the bookings for those routine assessments are being fulfilled and undertaken. And then overseeing new installs. So as I said, speaking to the RPA, making sure that the plans are being reviewed, making sure that the contractor involved in that installation is coordinating it appropriately, whether they're bringing in their RPA or whether you need to bring in your own, but they manage and oversee and help support that arrangement. And then ensuring that the training records are kept up to date, so making sure that GDC registrants are maintaining that 5 hours, that the original certificates are on file, and then giving people a nudge when their certificates are due for expiration. And again, not taking on full responsibility, but escalating any concerns with training or downfalls with that to the relevant person. Again, practice manager, principal dentist, or senior person in the group. So that they are essentially that middle person that helps coordinate everything, exactly the same as your safeguarding leads, your first aiders, as I've said, just to help get it all in place. So again, effective management of radiation compliance can result in effective delegation of these sort of roles to someone competent in the practice. Again, we see this role trying to be done by the principal dentist or the practice manager who's got their hands busy with lots of other things as well. try and delegate to someone else, share the responsibilities within the practice to make sure that these are all in place and that there's no downfalls then should CQC or HIW come in to inspect your practice. So hopefully that's given you some food for thought. Hopefully that will enable you to go away from this webinar, check that you've got all these things in place, and then if you haven't, what you may need to do. So a couple of last comments from the inspectors regarding an RPS. This shows here the top one. In this particular case, it did raise a wide smile, but they appointed an RPS but hadn't formally discussed that with them. So the inspectors can't come in, obviously spoke to a practice manager or someone else and said, who's your RPS? They had told the inspector the person's name. And then when that inspector asked the person, they had no awareness that was their role. So that's a very good example of not formally delegating that role to someone and telling them their responsibilities. And then the bottom one, then again, another example that's not formalizing it, not putting that appointment in writing. So hopefully you found that very useful. Hopefully there's a good couple of things to take away from that. I'm now going to open up the floor to any questions that you may have. So I'm going to have a look through now the question and answers, and I'll try and get through these as quick as I can to enable you to get back to your practice duties. So we've got a question here. How long do you have to keep your records for disposed X-ray equipment? That's a good question, to be honest. Not one I know off the top of my head. So I'll come back to you on that one, Lucy. I'll take that question away. I'll have your contact details, and I'll come back to you on that and send you a message with that one. So if you have new owners, do you need to re-register? If the company name has changed, then yes, you do. So if the name on your certificate is changed or any of the information on the certificate is changed, then yes. But if you change with it, if there's a change of people within the business, not necessarily. So a key part of your registration is to log into the Radan site on the HSE, check all the information in it, and just check that it remains up to date. If any of that information is different, if any of the names that you originally gave, if the number of equipment you originally gave, if the number of locations and the location names you originally gave are different in any way, then update your certificate. So it's a very simple process, to be honest. Just sign in, look at the information, and if it's all still relevant, you don't have to do anything. If there are any differences in it, then yes, update the registration. You don't need to re-register, as explained. All you need to do is log into the online portal on the Health and Safety Executive and just update the information. So it's not a complete re-registration. It's just you're notifying the HSE of changes, and then they will make those changes behind the scenes. And if necessary, provide you with a brand new registration certificate with that new information on. So, Sammy, do we need to complete step wedge digital films? So step wedge tests are predominantly for manual processes. And I know this question has come up quite a lot historically. So my advice really would be, because every RPA differs slightly in the templates they provide for quality assurance. So this will all be dictated by what they've provided you and what quality assurance program they've got as part of their radiation protection file. So historically, I work closely with a company called Dent RPA, and they had a radiation protection file with lots of various things. And they had a digital quality assurance program, which was a very, very simple online tool that you can use, very simple. And a lot of that was incorporated around your visual inspection of them. But different RPAs do vary. So my advice is, there's no blanket approach here for each one. It will depend on what they've provided and what functionality around QA they've given you as part of their RPF. So check the templates, check the online QA program if they've given you access to one, and complete what it is they've provided you. If you're not sure about undertaking any of the quality assurance tests that they've given you, speak to them, because again, that's part of their remit. that's part of what you're paying them and what you're contracted them to do. So speak to your RPA, ensure that you understand their quality assurance program. If not, ask them for training, ask them for support, and then implement those procedures accordingly. Okay. So I got a few messages on disposed. So yeah, I'll send an email out regarding disposed equipment. We'll find a way of sending that answer out so we can all collectively see it. So my HSE certificate dated 2023 says a practice name. So the certificate says the practice name. So again, it should be the business name. So if the practice name is different to the business name, it should reflect the business name. So the advice would be to update that certificate to reflect whatever your business name is, your company's house registration, essentially, not the practice name. So I got a question, is CPD training? If doing this training, does he still need to complete a 5 hours cycle as well? So, God, this is testing me now. So you need to do your 5 hours radiation training, but CBCT training is different. I'll need to look into that. We've put that into our staff training matrix in iComply. So we have got a CBCT training requirement in our new staff training matrix. And that does indicate the frequency on how often you need to undertake it. But I would need to jump in and have a look at that, which I can't do right now. So again, I'll have to come back to you on that one and provide the answer on that one. Okay, so another one. Okay, so I think that's all the questions. So apologies on those couple of questions I can't answer off the top of my head, but we will come back to you. We've got the answers in iComply. We've got the brand new staff training matrix in there that lists all the training requirements and the frequency of it. And we've also got our record retention in iComply as well, which lists all the retention periods for various records again. So I just need to refer to those 2 documents to get my facts straight, and I will come back to you and provide those answers. And I think that's all the questions, and I can't see any more. Feel free to leave and carry on for the rest of your day. Thank you very much.